Hello, my health literacy problem is offering telehealth to elderly patients. First, I want to cover what is telehealth. Telehealth is going to be a virtual appointment using computer, smartphone device, or a laptop. For a smartphone device, it would be like an Android or an iPhone. Since it's going to be a virtual appointment, it's going to be using, of course, internet connection, access to Google or Safari browser, having a camera and a microphone ready. Telehealth is going to be an alternative way for elderly patients to seek help regarding their health without going to their primary care provider nor to their doctors for that. Of course, we want them to lessen contact after what happened to COVID-19. Why is it hard for them to do telehealth? Of course, elderly patients, sometimes they don't have that luxury to have a laptop or a computer because, of course, they believe that they don't need it. For entertainment purposes, they have their TV, their radio, and their newspaper for that, and they also have their landline, and that's one of the reasons why they don't also have an smartphone, iPhone, or an Android. Especially with our elderly patients who lives in the rural side, there's no way that they would have an internet connection because it would have to have a poor connection or just a smartphone or any technology itself. It would also be hard for them to do telehealth because first and foremost, it was never done for them before. It was never offered for them before. And that's the reason why patient education is very important. I really feel like 100% once elderly patients are fully aware of what telehealth is and how advantage it can be for them and between their health plan and between their doctors, it's going to be taken advantage of, which is they should because it's already part of the benefits that they are entitled to. And I just want to discuss and describe and what I would like to do and how it should be accomplished. For this, I'm going to do as detailed as I can. First, elderly patients, of course, they really want to go old-fashioned way. With that being said, they want to be aware. By that, they want to receive something in the mail. Of course, send out letters what the telehealth is. Explain what is telehealth, how it can benefit for them, how easy it's going to be, how it's going to be no cost and no co-pay, who would instruct them to it, who would provide it for them, who would perform it for them. Those kind of information should be on the letter. And of course, send out step-by-step instructions to log in as well. As I mentioned earlier, it would be using computer, smartphone device, or laptop. It should be also say like it would be asked to have a valid email address, or just in case it's going to be a smartphone, then a phone number that is registered to that smartphone number. In that case, they are aware that once they schedule a telehealth, the link confirmation, a text confirmation, and email confirmation will be sent out to email or text with a link that they need to click on the day of the appointment. And also why it's important to have Google Chrome or Safari web browser for a telehealth appointment as well. Also, as I mentioned, those qualifications, it should also include to that step-by-step instructions to log in that internet connection, camera, microphone is very important. And with that instructions to log in, they should also provide a phone number that elderly patients can access to. So whenever they do have questions, they can easily dial it with their landline, with their smartphone, so they can ask those questions that they may have. Also, it should have the assurance for them that if they have any questions to reach out, and also if they are end up doing the telehealth, they should have a number to call to go ahead and schedule. And also to assure them that when they schedule, it's going to be fully aware that they will be given a reminder call, which is going to be prior to their appointment. It can be 48 and 24 hours prior to their appointment. And to conclude this presentation, as healthcare practices go around the country close their physical doors altogether or limited access to emergency services only due to COVID-19. Telehealth offers a virtual gateway that become instrumental to community, to care, to patients, and economic viability for practices as well. And I just want to talk about if they have an impaired hearing. Some of the elderly patients would have a hearing aid. Some of them doesn't want that, and of course we have to respect that decision. So for that, it should be health plan should include a they should include a caption. They should include a subtitle for the elderly patients to read for, and of course it has to be as slow as possible for their own pace. Second would be language. Of course, health plan varies in every state, so not all of them can be fluent in English in particular. Most of them can be bilingual. Most of them doesn't even speak English at all. So if a health plan does offer a nurse practitioner, medical doctor, physician assistant who doesn't speak English, health plan should also include and also offer a language number, a language help number that they can access to, so they can translate for them during the telehealth appointment. Last and not least is age. Of course, the older patients have the best chance to access with telehealth, with workflows includes with pre-appointment preparations. With that being said, if having the letter is not enough for them to learn what telehealth is, but of course they want to schedule because they learn how convenient it is for them without going, because some of them doesn't have transportation. Some of them work with their loved ones or their family to drop them off. Some of them get house calls, but it's not the same for every doctor's appointment, such as yearly appointments. With that being said, if they want to go ahead and schedule a telehealth, if they're going to use a smartphone, computer, or a laptop, it should be also sent like a link that they can click on with a video instructions on how it should be, a video instructions on how to log in. They can watch it many times as possible before their appointment. And with that being said, those are the things that can help elderly patients to go ahead and take advantage of telehealth. And yeah, thank you so much.